Welcome back to GMC Fox Edition. Today we're talking about healthcare literacy with Scenic City Wellness. Nurse practitioner Michalle Morris has some tips for us this morning. How's it going?
It's going well. How are you this morning?
Doing well. Good to have you here this morning. First off, for people that are watching this morning, what is healthcare literacy and what is dependent upon all of this?
Healthcare literacy is the process of obtaining and gaining information about healthcare topics. It's also about using that information in a positive way. So it is dependent upon your culture, also about knowing about the topic, also about communication and the situation when you encounter a provider or the services.
And I have to ask you, why is this topic so important in your opinion?
It's very important because only 12% of people are proficient in health literacy. So that means 9 of 10 adults are only able or lack proficiency in making decisions to manage their healthcare disease or preventative measures. And out of that, 14% of people are below health literacy. And so that means that those people make poor healthcare decisions and also probably lack health insurance. And so with that being said, it's hard for them to navigate the healthcare system. It's hard for them to find providers. They don't take the time to fill out the complex forms that we sometimes give them. They don't engage in making decisions, proper decisions, and so that leads to poor health outcomes.
So for people watching this morning, who is at risk when it comes to this topic here?
Older adults, people with less than a high school education or GED, racial and ethnic minorities, as well as people with language barriers.
And for folks, how can they overcome this, in your opinion, from a medical perspective?
I think it's up to the public and private providers, as well as the public and private healthcare systems, to engage each individual when we encounter those individuals, to make the most of that. And so we need to make sure that we are listening to them, that we speak clearly, that we make those forms as simple as possible. More does not always mean better, that we simplify those forms, that we make the system easier, more accessible, and that we provide them with the information that they need, and that we educate them.
And then from your perspective, how does being in the medical profession and being able to help people understand their diagnosis or those health terms that they may not understand, how does it make you feel to be able to help them in that way?
It gives me great joy and pleasure to be able to do that. So as a healthcare practitioner, I spend a little bit more time with my patients, and I always ask them initially, tell me, what do you understand about your disease? So that way I can expound on what they already know, and then I can go from there. And then I tell them, do a little research on your own, and when you come back, ask questions. It's okay to ask questions. There's no such thing as a silly questions, because when you know better, you do better.
Amen. Sounds good. Michalle, thanks for coming this morning. Here's information on your screen. If you have more questions this morning when it comes to healthcare literacy or any other medical questions, give Michalle a call today. There's her information on your screen, or visit her website, scenicitywellness.com. Michalle, thank you for coming in this morning.
Thank you for having me.
No problem. Now let's go over to Aaron for a look at your Storm Track 9 forecast.